For people who are working to overcome a substance abuse or addiction issue, often one of the first steps is to detox. But sometimes finding a place to do that can be difficult, and that's why Allen Parish Hospital has started New Vision, and Latasha Bello is here to tell us all about it. Thanks for coming in today.
You're welcome.
And this is a big problem across the country, let alone our area. What kind of addiction issues do you see prevalent in our area?
Well, it's absolutely all the way across the country. Here in Southwest Louisiana, we are starting to get calls for alcohol and opiate addiction. That is, of course, not the only thing that we treat. We treat alcohol, opiate addictions, benzos, things like Valiums, prescription pain medications, but that's generally what we're seeing here in Southwest Louisiana.
Okay, and for people that have gotten to that point where they realize that there is a problem going on and they want to make a change in their life, sometimes when they're ready to do that and they're looking for a place to go detox, there's no beds available. And that's kind of why you've decided to start this program.
Absolutely. The limited number of beds here in Southwest Louisiana, it's staggering compared to what our substance abuse problems are. And this is directed admit at Allen Parish Hospital, where they can go and seek the first step for medical stabilization. Is the most harmful step, actually, and it's the one that they really need to be in the hospital for.
And that's the key to what you're able to offer, is that it's right there in the hospital. What additional benefits do you get from detoxing at a hospital?
Well, we have medical professionals that are going to tend to the patient. So we have a medical director, Dr. Ugoba, and he's been with the hospital for 15 years. He's very knowledgeable. They're going to be tended by nurses and other healthcare professionals. We'll be able to treat the comorbidities that come up with substance abuse. Oftentimes with substance abuse, people will have problems with pancreatitis and liver disease and heart disease, high blood pressure. They're being treated by nurses and physicians, so we're able to care for them very safely.
Okay, how long do most people have to stay? Is there a specific length of time, or does it vary?
It varies. Generally, the typical stay is 3 to 5 days, but each plan is individualized. So we're going to treat the patient that comes in the bed. So we never discharge anyone that isn't ready to leave. We're going to make sure that they're safe and completely withdrawn from the substances before they leave our services.
All right. And for those people that are trying to overcome addiction, detox is just the first step. And you help them kind of make the rest of that plan as well, so they're not discharged from the hospital and right back where they started from.
It absolutely is very important to not only detox, but that they have an aftercare plan. So from day one, we start discharge planning with them, making them aware of the resources that are available. Sometimes people just aren't aware of what's available to them to help them in their recovery process. So we do extensive discharge planning with them. We get them with a primary care physician if they need it, a substance abuse counselor if needed, and we get them all of the help, including an inpatient stay if they need that as well.
All right. You do not need a doctor referral to call and find about this program, this New Vision at Allen Parish Hospital. You can call the number that you see on the screen. That's the number there as well. If you didn't catch it, just give us a call here at the station. We'd be happy to pass that along to you, and hopefully you can make that first step, if you need it, towards recovery. Thank you for coming in today.
Thank you for having me.
Appreciate it.